Hello there, welcome to the clinic. I was just getting your notes ready. So today we have 4 key areas to explore. It's going to be oral, ocular, nasal and the auditory system. The first thing I'm going to do is have a little feel inside your mouth with these fresh gloves. So open wide please. Check for any lesions. Just raise the tongue, please. Okay, tongue flat. I'm just going to feel the roof of the mouth here. And sides. That's fine. I think next we'll have a look inside your mouth with some light. But first, let's get some hand sanitizer into play. Okay, please open wide again. Keep the tongue flat. And raise the tongue to the roof of the mouth. Tongue flat again. Okay, tongue just to the side of the mouth there. And to the other side. Open wide again please. I'm just going to rest this on the tongue. Just say ah. And again. Okay, open wide again. It's a bit of mirror as well. Checking the teeth individually there. And relax. Unfortunately, we are out of sweets, so no taste test today. Please say I'm not feeling any lesions inside the mouth or seeing anything untoward. In terms of your teeth, it may be worth seeing your dentist for a scrape and polish. I'm now going to move on to the eyes. First thing I want to check is your vision. Please cover your left eye with the palm. Have a look at this chart and read the smallest row that you can, please. Okay, cover the other eye. And try the smallest row possible, please. not too bad. I want to work on eye movements now, so what image can you see there? Okay, follow the image just with your eyes. Report back to me any double vision of the image. Excellent, thank you. I would like you to follow the tip of the pen towards the nose here. Again, report any double of the pen. And back. And just in again once more. Okay, please look towards me. I'm just going to do a cover test here. Okay, please focus on this new image. Just looking at the wall behind me, just a bit of light. Let me use this scale just to check your pupil sizes. Just look towards me. They do seem equal. But I just want to be very precise. Right is 4 and left is 4. Good. Just to wrap up the ocular section, I'm just going to have a little look at your optic nerve and macula up close with the ophthalmoscope. So please just look at the wall behind me. Also just ensure that there's no cataracts. Okay, clear media, ocular continuation here, optic nerve, looks healthy, and I'm just going to have a cross look at the macula. Looks really good. And for the left eye. Cornea, vitreous, back lens clear, okay, optic nerve. It's well defined, good colour. I like the look of the vessels, the margins, and the macula. It's going to be a bit bright. Excellent eyes. Right, that concludes that section. Let's move on to the nasal portion. So first thing I want you to do is just block one nostril, like so, and just breathe in and out through the other nostril, please. Okay, just block the other one now, and breathe in and out through the other one. Okay, just tilt the head back, please. Just a little bit. Just going to have a look at the nasal passageway. And again, please. Looking at the openness of the pathway. There's no polyps, things like that. It does appear clear. Now I'm going to move on to a simple smell test. Just going to breathe in and we'll see if we can identify some simple smells. So just through the nose there, please. And you feel that one is orange, correct? Okay, breathe in again there. That's vanilla. Good. Okay, you should get this one. It's a common one. Cinnamon. And the next one here, please. Just take that one in. Correct. Peppermint. And finally, let me just visually inspect your nose. Check that there's no lesions externally. I can increase magnification here. Certainly don't want anything like carcinomas, do we? Okay, now we're moving on to your ears and hearing, the auditory system. Let me have a little look at the otoscope and light at your ears themselves. Okay, any recent ear infections, loss of hearing, any pain to the ears? Clear. Okay, let me have a little feel of the ear, again for any lesions. And let me have a look through your ear canal now. Okay, internal, external portions, and back through to the tympanic membrane. That's a normal level of wax, nice colour. No signs of any damage there on the pathway, thank you. And for the left ear. That's pearly white. Evidence of any inflammation or scarring. Okay, just the opening there. Good. Okay, we'll finish up with some hearing checks. The first of which is a whisper test. I have some medical terminology to whisper in each ear. You just repeat what you think you've heard. Okay, here we go. Hypertension, arachnoid, somatic, blepharitis, keratitis, varifocals, exudate, clavicle, canine, melanin, vagus, axis, hyphema, cerebral, aqueous, vitreous, arterial, vasodilation, quadrantanopia, rupture, peptide, opacification. You seem to do very well there. Let's move on to the other side. Arcuate, tendinitis, cerebellum, punctate, contusion, hematoma, retinopathy, endoscope, ischemic, fundoscopy, membrane, pancreas, sciatica. Very well done there. I hope you found it relaxing. Okay, the final element to your hearing examination is ringing the tuning fork. Firstly, placing it on the top of the head and asking you to let me know when you stop feeling the vibration. Alright, here we go. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Marvellous, 17 seconds. Next I'll ring it and place it just adjacent to your ear. Just tell me when you stop hearing the sounds and vibrations. 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 isn't bad. And for the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Thank you. Well, that concludes our concise medical examination of mouth, eyes, nose and ears. That was the Weber and Rin tests there. Excellent work, so my recommendations are to see your dentist for a scrape and polish of the teeth, and maybe book in for an eye examination to have your vision checked a little bit further and to see if there's any refractive error. So unless you have any questions, I'm going to sign us off for today, and I'll probably see you again in about 2 years.